guys, it's Carolyn, digital editor here at NewBeauty, and today I'm with Dr. Peredo on the Upper East Side in New York to do a really special customized treatment that she developed.
Yes, welcome,
Yes.
Caroline.
Thank you.
How are you?
I'm great. So I'm here because I have some skin concerns that I'd love to talk to you about.
Absolutely. I'm going to give you a mirror so you
Perfect.
could point to what bothers you, and
Okay.
we'll talk about
We'll
what
do
how
it?
can. Absolutely.
Okay. So I did something bad. I had a breakout and I picked it. And now there's a lot of hyperpigmentation there. So hopefully we can maybe
Address that.
Aside from that, though, I just kind of want general like luminosity, glowing skin, smaller pores, preventative anti-aging. Just kind of want to, in a few days, look better.
Everybody wants
Right?
the same. Why not? Perfect. And it's
Yeah.
a perfect time for the holidays, right?
Yes, exactly.
So, normally at Skinfluence, we kind of customize our treatments, and I agree with you. I mean, you have gorgeous skin to begin with,
thank
right?
you.
But why not make it even more gorgeous?
Exactly.
So I do see a little bit of uneven pigmentation. I also see a little bit of, large pores, nothing, very dramatic. And so we'll do a treatment that will kind of address everything.
Okay.
We'll start with a laser peel
Okay.
that will kind of address mainly uneven pigment and the pore size. Then we'll kind of transition it to go like a little deeper. So we'll use microneedling for kind of second part.
Okay.
And that will address not just maybe larger pores, some of the acne scarring, some of the pigmentation, and then we'll use our secret blend of platelets and our special creams to kind of seal the deal.
Oh, I like that.
Okay?
And you have a great name for this treatment.
Yes, we call it Skinfluencer.
Because all the influencers who need perfect skin should be coming in to get it.
Exactly.
Right? Gotta
Right.
get your...
And we have a master magician, Joanne, who's going to be
Hi.
performing the
How are
treatment.
Okay.
The whole staff is addicted to that, and we customize it. So not everybody may need all 3 steps. Some people who have, more acne scarring, we go a little deeper. Some people have more hyperpigmentation, we use different laser blends. So it's customized for every single patient.
I love that. So you already put numbing cream on me.
Right. And we already took your blood.
And we already took my blood, exactly.
And you did great. You
Oh,
didn't faint.
thank you. I know. My accomplishment of the day. But so it's not going to hurt too much, right?
Right. It's not.
Okay.
It's not going to hurt too much. And we have a great numbing cream to start with. And for people who are very very faint at heart, we have this new toy called Pronox, and it's a combination of nitrous oxide and oxygen. That's a lot of times used. It's actually a better mixture that's used in the dentist's office. It's used in birthing centers, and you kind of do it at your own pace. You inhale it, and when you feel like a little buzz, a little happy, you're in a happy place, you stop, and you feel a little discomfort, but you feel absolutely no pain.
Gotcha. Well,
you don't need it for this
I don't need
treatment,
it, yeah.
but we have some people who are very very sensitive and just don't like needles.
I love that you have options for everyone, right?
Absolutely.
So great. Well, I have a decent pain tolerance, so we'll see how this goes.
Okay, perfect.
Cool. All right.
All right, so we're gonna recline you. I'm gonna
Okay.
be here assisting and answering questions.
Okay.
Okay.
Great.
For this treatment, we're gonna, for the first part, we're just gonna cover your eyes.
Okay.
So just because it's gonna be like a bright light.
Okay. So this is the Clear and Laser, or sorry, Clear and Brilliant.
Brilliant, right? So if you think of Clear Brilliant, it's kind of fractionated resurfacing.
Okay.
We think of this as kind of baby Fraxel.
Ooh, I like that.
And it addresses. Okay, and so we're ready to start.
Okay.
I'm gonna start with the forehead.
Okay. Is it going?
You don't feel it.
I barely feel it.
See? That's perfect.
Oh wow. Okay. And so, what does this laser do?
So this laser treats the surface of the skin, and it creates microscopic injuries to the skin, kind of full skin to think that there is trauma. And by doing that, it kind of stimulates fibroblasts, skin cell, to produce new collagen.
Gotcha. So I know a lot of celebrities really like this laser. Is it something that's good for everyone?
So it's a great question. It's good for everyone. The beauty of this laser, it's to treat all Fitzpatrick type skin, so from very, very fair skin to darker skin,
Okay.
which a lot of lasers you have to be careful with.
Right.
It has different settings and it has different heads, so we can customize it to specifically. So what with the settings we're doing for you, we're addressing not just the pore size but also uneven pigmentation, right?
Right.
Some people, if they don't have pigmentation problem, will go with different setting and different head.
Gotcha. That makes a lot of sense.
Right.
Mhm.
But let's say if we just did this treatment by itself, it would also give you nice results, maybe not as much, beauty and glow, but it's still, it's a good, we think of this as a laser peel.
Right. So for people who come get Clear and Brilliant, is it a multiple session thing, or do you just kind of do it once and?
Right. So it's a great question because it's very non-invasive treatment, right? And the reason we call it baby Fraxel, it's not painful. There is not a lot of downtime. It normally requires several sessions to get the best results. So let's say on average we tell patients about 3 sessions.
Okay.
But people fall in love with this treatment because you get such a beautiful results that a lot of our patients come just once a month for to get more brilliant.
Right, like a maintenance treatment.
Yeah,
right?
absolutely.
That's awesome. So you were telling me earlier that doing this in your 30s is actually really smart because then you get better skin as you get older. So it's preventative.
It's preventative. And what the new study showed, when it actually doesn't even matter what treatments. When we just talk about great skincare products, treatments, when you start at when you start in your 20s, you age better.
Okay, so I'm a decade behind, but
I'm sure you've been doing other things for your skin, right?
Yeah.
And we tell patients when you start with beauty treatments, right, in your 20s, if you're good about your products and skincare, right? You wash your face, you're going to sleep with makeup, you use great products, you use sunblock, you're already kind of ahead.
Right.
But if you also, like in your late 20s, early 30s, if you invest in some of this type of treatments, whether it's a light laser peel, whether it's, millennial Botox or filler, you are preventing aging process. And you, even if you're aging better.
Right. Well, that's right here. What is it? Like an ounce of prevention is better than a pound of cure or something like that, right? It's always easier to prevent than to fix.
So now I'm looking at your skin. I know you can't see it because your eyes are closed, but you could see that the areas were treated, they have like a nice pink glow. So almost like you had a little bit of a sunburn.
Okay. Is that normal?
That's perfectly normal, right? You're getting this nice kind of even pink glow.
And how long does that stay for?
Normally it stays probably for about a day, but because we're doing the Skinfluencer treatment and we put in we seal it with the golden serum, it'll cut down on healing process even faster.
Gotcha. Yeah, it feels pretty, I can feel a little bit, but it's super tolerable. Right? And do you always put numbing cream on for Clear and Brilliant?
Again, depends on the patient. Some people have, incredible tolerance and they just don't want anything, and it can be done, even I, who's terrible with pain, sometimes do it without numbing, but, we kind of customize everything and we just want to make it as comfortable as possible.
Right.
So it's definitely an option.
Gotcha.
We can take it from no numbing to topical numbing to inhaling numbing.
Yeah, wow.
And so you can see what Joanne is doing. She's doing several different passes, kind of to ensure that the whole skin surface is evenly treated. So, because your skin is, overall is in great shape, we're kind of doing it very uniform, but for some patients who may have more of uneven pigment, more of acne scarring, more of very prominent pores, she may concentrate and kind of stay on the areas that needs to be treated a little longer.
Gotcha. So even like fresh hyperpigmentation, I can come and get this to treat it.
So the beauty of our combining treatment, we could treat anything. So we had patient who was a couple years ago in the fire and had actually severe burns
Oh wow.
and a lot of not just hyperpigmentation, so uneven darker skin color, lighter skin color, and a lot of scarring just from the way the skin healed. And we did this not exactly the same combination treatment, but something similar, very customized, and this patient's actually doing incredibly well.
Wow. So your customized treatment, you can treat a variety of skin concerns, variety of ages.
Correct.
Yeah.
Yeah.
So it just depends on what the patient needs.
Exactly.
Now, is there like I've heard that it's better to kind of get these treatments in the winter rather than the summer. Is that true, or am I making this up?
No, you're partially correct. I mean, the beauty of this particular treatment, this laser is color blind, so we could treat different skin types. We can treat, very, very light skin. We can treat dark skin. It's always better not to be in the sun right after because the skin is just more susceptible to, hyperpigmentation after the treatment.
Well said.
Well said. The first part is done.
Wow, that was pretty easy.
Now I'm gonna take the patches off, and I want to show you part one.
Okay.
What a nice.
Patches were a good look.
Yes. What a nice
Oh.
glow you have already.
This is like nothing. I mean, it's nice. It's
Right.
not, it's a little pink, but it's.
Right.
I could go to work like this.
Totally.
Right?
Totally.
It looks so even. Thank you.
Yeah, you're welcome.
Wow. All right, I'm ready for part two.
Exactly. Keep the patches on or off?
I
Up to
can
you.
keep it off.
Okay.
Yeah.
Perfect. I'm gonna be assisting you here.
Okay. So this is the microneedling, right?
Right.
Which I've heard amazing things about.
Just wanted to bring the chair up a little bit.
Okay. Sit down.
Not just.
Oh, you mean-
Yeah. I'll just go up. Okay. Perfect. Okay. And I'll take focus. Beautiful. So now what we're gonna do is microneedling is gonna. Well, it's making noise, right? Yeah. And what we're targeting now is just we're gonna maybe just get it lightly here, and we're gonna concentrate on the area, that you have more of a problem skin.
Okay.
Okay, perfect.
So I have a little Botox on my forehead, no problem?
No problem at all. Yeah, it'll be actually very nice and complementary to Botox.
Great.
I'm just gonna cover your eyes, if I get.
No, you got this. Go on. Oh, is that PRP?
Yeah,
PRP.
we're sprinkling that.
Wow. Okay, I feel this a little bit,
Yeah.
but not the worst thing I've ever felt.
Right. And so what we're doing with this, we're kind of taking the PRP, we're driving it into the dermis of the skin, right? So, and so this, where the marker? And kind of the thought behind this is we're creating this fertile ground now for the platelets to message other cells to stimulate not just collagen, but collagen, elastin, to kind of maintain your skin youthful elasticity.
So can you tell me a little bit more about PRP? I mean, I know what it is,
Right.
but you probably know more than I do.
Right. So basically what we do, you come in, we take blood, right, and then we put it in the tube, spin it, and then we get rid of red blood cells and white blood cells, and basically we leave platelets and plasma. And because we do not do a lot of treatments, in the United States with stem cells, but I think the future of medicine, anti-aging medicine, is going to be stem cells.
Oh, okay.
Platelets, I think of platelets like a sister cell to stem cells.
Okay.
Basically, platelets are messenger cells, and when you put them in a skin, they stimulate skin cells to produce collagen and elastin. We use platelets for hair loss. So when you inject platelets into the scalp, they stimulate hair follicles, to come out of the sleeping stage and, make new hair. platelets were used in orthopedic surgery, in sports-related injuries, for injections into joints for several years now with really, really good results. So kind of think of platelets as little messengers that will stimulate whatever they need to, depending where they place.
Gotcha. You can also inject the platelets too, right?
Correct.
As filler almost?
Right.
Yeah.
So a lot of times with our younger patients or the patients who may be afraid of fillers, we use, are you dripping a little bit?
A little bit, yeah.
We use PRP is injectable. And
Your nose?
your nose? Okay. Joanne is the boss. She tells me what to do here. I need to put some light on. Right, so we inject platelets, a lot of times it's with the younger patients. We use it for areas like tear troughs, under the eye. I inject a lot of times when there is a lot of lines and wrinkles, so like the texture of the skin is not perfect. But for this treatment, when we apply platelets, with microneedling, we have open channels in the skin from laser and microneedling, and it allows platelets to kind of seep through, and we treat in all the levels of the skin. So we treat in epidermis, more superficial layer, and we go all the way to dermis. So now the benefit of doing this, especially in the area that you have large pores, with microneedling, we wounding the skin, right? So just the needles creating wounds will stimulate collagen production, but now we doing it by different channels. So it's the wounding with needling and then placing PRP
Into it.
right.
So how's my face? Is it bloody?
It's very mildly,
Okay.
we use this tiny pinpoint bleeding.
So when you watch like Kim Kardashian doing this, her face is super bloody, but that's
Right.
not what the real experience is.
Oh, I think it depends. If we need to treat like very severe acne scarring, we can make it super bloody. Sometimes I think when people show this vampire face, I think they're using the whole blood and not just PRP.
Right.
To make it really, really red, but you could see it's pretty clear.
Yeah. And so you said the microneedling, there's different depths.
Right.
Can you kind of tell me what like the minimum and the maximum and when you would use the different depths?
Absolutely. So if we want to kind of do achieve overall glow, if we use it microneedling mainly to treat uneven pigment and just minimize the pore size, we dial it to kind of not a very deep depth, right? So maybe 0.5 millimeter depth. However, if patients have a lot more uneven pigmentation, a lot more acne scarring, like a deep acne scars, we can dial it and penetrate the skin deeper. That will create more, more bleeding, more injury.
Gotcha.
And that's why the treatments are so customized, right? Because not everyone needs to go through downtime and discomfort of, more in-depth wounding. So you kind of a perfect example when we do it a little more superficial because, you're already starting with really great skin.
Well, thank you. A better skin
Agreed,
after.
Joanne?
Agreed. And how many sessions do most patients need?
Most patients, so someone like you who's young, who's already beautiful and has great skin, and we're just kind of doing it as a prevention, kind of small tweaking of couple, pimples that you picked and pore size. I think it would be fabulous with just, anywhere from 2 to 3 treatments. Especially if we're doing kind of this combo treatment, right? The beauty of doing combination treatments is you're gonna need fewer treatments. Because we're kind of addressing all the issues all at once. If someone has a lot more acne scarring and uneven pigment, they may need more like 5 to 6 treatments.
Oh, gotcha. Okay.
Right?
Yep. And then how long do the results last for?
So the results are pretty sustainable. You know, once we get to the point that skin looks great, but normally, because you see how skin looks, you know, healthy and you see a nice glow, patients do come for maintenance. And maintenance could be done monthly, you know, bi-weekly, weekly.
Wow. You can do this once a week.
Probably not this whole treatment. I would say this treatment I would do like maybe every 2 weeks.
Okay.
But you know, we could alternate. How do you feel?
Pretty good. I mean, I can feel it, but not too painful, you know? It's worth it for the results.
You'll see the most improvement after a couple of days. So maybe the day 1 or 2 after, the skin is gonna feel like a little gritty.
Okay, so we'll peel a little bit?
Right, we'll peel a little bit. We'll talk about the products that you should use afterwards, kind of to maintain the glow. And I think about a week to 2 weeks later, you're gonna have, you know, the best results.
I love it.
It'll be perfect for the holidays.
I was gonna say, just in time for the holidays, right?
In time for the holiday glow.
Do you have any holiday plans?
I am making a turkey. I normally cook once a year, like a real meal.
Right.
So I'm having family over. My daughter and her boyfriend, and my boyfriend and his family.
Oh, it's so great.
Yeah, and then I'm planning maybe a little escape after Christmas.
Oh, somewhere warm?
No, actually, I want to go somewhere cold.
Okay.
Believe it or not.
Yeah, because
Somewhere in Europe.
Oh, amazing.
Yeah. How about yourself?
Just gonna have glowing skin and try to see as many people as I can, because I'll have better skin.
To show it off?
Exactly.
Beautiful.
So this treatment doesn't take very long. We're almost there, right?
We're almost done.
And is this something, like you said, anybody can come and do? Because you would customize it for their needs. And PRP is safe for everyone?
PRP is safe for everyone because it's really your own blood with platelets. And I think it's just a wonderful treatment.
Are you using a lot of PRP in your practice?
We use a lot of PRP for different uses. You know, this is very popular with facial treatments. We also use a lot of PRP for hair loss.
Okay. Big topic.
Big topic, great results. You know, initially when we started the treatment, I was very skeptical because, you know, in dermatology for the longest time when people came with hair loss, I would cringe because I had absolutely nothing to offer them. Now we've seen really nice improvements. Again, it's not 100%, it's not for everyone, but I would say with patients we treat, we get about 60 to 70% improvement.
That's pretty great.
Right. Whether it's hair regrowth, whether they feel that it prevents shedding.
I just want to do this spot.
Okay.
I'm just going to dial it up a little bit.
Okay, so we're going to focus
brown
now.
spot that
Yeah,
shows
okay.
me.
The spot that you picked.
I know, I messed up.
We're going to go
I turned it up,
somewhere.
yeah.
Okay.
Okay, go for it.
All right. You may feel a little pinch there.
All right,
Okay.
it'll be worth
I
it.
just need some PRP.
How's that?
But
It's all right.
Feel it a little bit more though.
A little bit more. Are you going deeper?
Right. So this area we're trying to wound a little more so you can see a little bit more bleeding. I'm going to show it to you.
Ooh, okay. I see it.
Right. Now you see,
Yep.
now you don't.
Oh, and I have all that extra PRP left over.
Yeah,
Should I take it home?
absolutely. I'm just going to apply it like we're going to seal the deal.
This isn't bad at all. I mean, I'm a little red, but like a little
Right,
sunburned.
but the beauty of using PRP right after the treatment, it actually is going to cut down on the healing time. Because, you know, what platelets do, they kind of stop the bleeding, if you think about this, right? And they heal the skin. So using PRP right after, by tonight, you're gonna be slightly pink. By tomorrow, you're gonna be totally
Normal. All right.
So tonight, nothing. Tomorrow, we're gonna talk about skincare now.
Okay, so no, I don't put anything on my face
You
today.
don't need to, because
Okay.
this, the golden
This is it.
serum
Okay,
will do its thing,
okay,
right? How you feel, first of all?
great. It was easy.
Okay.
Yeah, I think I thought it was gonna be more intense.
Right. Oh, you were a great patient.
And it looks fine.
Yeah. Imagine the glow you're gonna get. It's already glowing.
Right, I know.
If you could see, it's already, the pore size already kind of diminishing, right? Just a little
Mhm.
tighter.
Yeah, it feels tighter.
Yeah.
Yeah.
Perfect.
Okay, so I don't wash my face or anything?
You don't wash your face tonight.
Okay.
Tomorrow, we're gonna send you home with Apple products.
Okay.
You're gonna use, we have our Skinfluence Alpha Cleanser.
Okay,
It's just a great product. It has papaya extract.
okay.
So it's great for any kind of skin type, but especially post-procedure. It's gonna be very, very nice and gentle.
Okay.
And then, you're gonna use, this is kind of one of my favorite products. You've used it already?
Elastin. I love the brand.
Yes,
Yeah.
I love it. I love the brand too. So Elastin Nectar,
Mm-hmm.
see and feel it. It's very soothing.
Ooh, it's nice.
It has a lot of great products. It's arnica. It has peptides, but it also has dimethicone, which is feels like a liquid silk.
Yeah,
It's also great post procedure.
this is good for put.
Right.
Okay.
So starting tomorrow, you can use that morning and night.
Okay.
You're gonna use also sunblock.
Yeah.
I'm gonna recommend that to you. And then
Okay.
what I'd like you to do, maybe like a week after, this is
Mhm.
another great product. It's Skinfluence brand. It's
Mhm.
called Skin Polish.
Okay.
But it's a mask
Mhm.
/ scrub.
Oh, I
So you
like
put it
that.
on. It's
Mhm.
anhydrous. When you put it on with water, you feel the heat.
Mhm.
So it kind of
Ooh,
heats
okay.
up, and you gently, like in circular motion, just gonna use it as a scrub. And
Okay.
it's gonna get all that grittiness post procedure off, and your skin
Okay.
is just gonna.
Can't wait to try that.
Oh my God,
Sounds
it's a great
awesome.
product.
Okay.
Everybody's, and you can use it on your elbows and knees.
Okay. I
Okay,
will,
for dry
because-
skin.
Exactly. Last question.
Yes.
Is there anything I should avoid? Any ingredients, makeup,
Yes,
alcohol?
definitely no alcohol.
Okay, good. Yeah.
It's a holiday
It is
time,
exactly
yeah.
right. Mhm.
Drink as much as you want.
Okay.
I would say I wouldn't do things like maybe hot yoga and
Mhm.
exercise for the next maybe day or two,
Okay.
only because with sweating, the sweat is
Mhm.
gonna be very irritating,
Mhm.
right? It's gonna
Mhm.
burn a little bit more. In terms of products, we're gonna set you up with products, so we're gonna
Okay.
control what you're gonna use.
Okay.
So we're just gonna stay with those products, and
Great.
otherwise,
I'll send you my
No
selfie
retinols,
in 2
no
days.
glycolic acids.
no retinol, no glycolic acid.
Okay.
But we control it that because
Yeah.
we're telling you what
Yeah.
to use, right?
Okay.
And then, if you have your own skin routine, I would say maybe like a week later, 10 days later, you can go back to what you've been using.
Gotcha. All right. Well, I
Okay.
can't wait to come back and
Oh, you
see
did
you with
great.
my better skin.
Yeah.
Thank you.
We actually have one question from a
Okay.
viewer.
Okay.
Oh.
Someone's going in for Fractura. Is that a good laser for tightening?
Fractura is a good laser protector. I don't do it, so I don't have my personal experience, but from what I've heard from my colleagues, it is a good laser for tightening.
Awesome. All right. Well, if anybody has more questions, put them in the comments below, and we might call you to get them answered.
Wonderful.
All good.
Happy holidays to
Happy
everyone.
holidays.
Yeah.
Thank you to me.